Who is he? He is me. Hi, I'm Rafi Redzwan. This is he. Here is my chance to share some amazing stories with some amazing people that are inspiring to me. He celebrates everyday people of everyday life. He revolves around conversations that inspire others to change the world and make a difference in life, with a little bit of laughter and a whole lot of drama. Join me for personal stories and experiences on health and healing, successes and failures, recovery and discovery, anything relatable, and anything in between. He elevates us to rise again and live our very best life. Just so you know, you are not alone. He is with you. And you did mention about your hope is to share your fruit of labor. Would you share it with me?
Oh, mate. No, we can definitely go down this path. No worries, no worries.
All
If there are
right,
fruit,
wonderful. Thank
if
you.
there are fruit there, let's
Uh-huh.
yeah, the more the merrier.
Tash-Aneiq Shamshul Baharin believes the critical change in health starts with you. In this episode, he begins the journey in the discovery of the founding of Nexuses and the story behind building a health tech startup to change how the healthcare industry operates to improve medical treatment. The simplified system provides patients the ultimate control in organizing and utilizing medical data effortlessly to get an accurate diagnosis the first time. It dives into his duty as a founder, techpreneur, and chief visionary officer in setting up the platform to optimize the system to its fullest potential. He aims to set the establishment apart from other leading medical technology and contribute back to the world by focusing on himself as a person who can emulate the world around him to change. This is his story. Hi Tash.
Hello, how's it going?
Good, how are you?
I'm doing all right.
It's good to have you today on the show.
Yeah, thanks for having me here.
Yeah.
Um, I'm excited to be here.
I'm excited to have you to talk about reimagining and optimizing the future of health technology. Let's talk about the founding of Nexuses and the story behind how you build a health tech startup and change how the healthcare system operates to provide a magnificent development in improving the healthcare treatment. Hopefully, we'll dive into your duty in setting up the platform, how patients can optimize the system and utilize its benefit to its fullest potential, and how you set the establishment apart from other leading medical technology, and how you and Nexuses are contributing back to the world. How did the founding begin, and what is the story behind Nexuses? Yeah.
So yeah, Nexuses started in 2019 with an idea of what if we could just basically address problems in our own life with what we already have rather than what we don't have.
Right.
That was the fundamental question or idea of Nexuses. So in the beginning, how we translated this idea was in computing, actually, right?
Mm-hmm.
So the idea is, well, everybody has computers in their hand, smartwatches, tablet, phones, you name it. And the idea
Mm-hmm.
is, what if we could pool the computing power from all these devices so that you get to have one strong computer if you ever need it, I suppose, or you can sell this computing power if you don't need it. But in 2020, I decided that healthcare was the way to go. This was right before the pandemic, so uh, I made the switch. Not dropping the computing idea, but rather just putting a pause on it. To focus something impactful for me. With myself and people who are close to me, because I think
Yeah.
computing power not everybody needed, but healthcare
Right.
at one point to see a doctor, right?
Mm-hmm.
Right. So that is when we make the switch. So
Mm.
um, in the beginning, or what we're trying to, so diving into healthcare with our own idea of, let's say, what can we do, right, to make use of what we already have, to get, let's say, now the ideal medical care, because it turns out it's unfortunate that not everybody who goes to see a doctor, who goes, visiting the doctor's office, will get what they need. That's unfortunate. So we just took a deeper dive into this, and and voila, this is like what Nexuses is
Wow.
today. Yeah.
Yeah. And why is this change in the health system is critical to the world? Um, I'm a user of something similar in the past,
Right,
and
right.
I see this is very helpful for me if I go to see a doctor, and that I have every information that I need on the palm of my hand, and as soon as the doctor see it, um, they're able to help you ahead of time without waiting this information from other places. Yeah. And
Right.
so why is this change is critical to the world?
I think the change is critical because at the moment, your medical data as a patient
Hmm.
towards your medical provider. So
Hmm.
almost anywhere in the world you go, and you visit, a hospital or clinic, your medical data is actually kind of stays with them instead of yourself, right?
Yeah.
And but the clinic or the hospital do not go wherever you go. So it's unfortunate that your medical data isn't there to begin with to help you,
Yeah.
because as a patient, we do not have much influence in the healthcare industry, let's say, right? We don't make a lot of the decision making. We're more of a passenger once we go to see the doctor, right? We go there,
Hmm.
and then from then on, it's a ride throughout your medical journey rather than you're in control of it. So
Mm.
the fundamental or the biggest change that we make, although it might sound simple, that you take control of your own medical data, is actually already, flipping the healthcare industry inside out, right? Because
Yeah.
now
Yeah.
you're in control of it. You're no longer a
Hmm.
passenger, right? So
Hmm.
I think this is the biggest change, I suppose, in what we're doing right now.
Especially in Malaysia, I think having to go to places like the private hospitals or the private practice and then the government, um, they have different practices. Yeah. And being able to take that information into a system that would be very helpful. But how easy it is for a user to actually obtain this information from their medical provider and place it into the system.
So right now, if you try to retrieve your medical info from, let's say, the public hospital or the government hospital in Malaysia,
Mhm,
we have a law that
mhm,
allows the medical provider to have up to 30 days to give you your own medical data,
mhm,
right? So there's already a delay there, but you can start from there, right? You gather your own medical records and you can just upload it to our system, right? Nexuses Chronicle.
mhm,
You
mhm,
can just scan it or take a photo. Because ideally, we will want you to have those medical records as a supporting document, that you're claiming that you've had in your past, right?
yeah.
As a medical, sorry, the things that you've gone through medically, so to speak, right? Because
Yeah.
right now, what exactly you're doing is that now the medical records is with you instead of your medical provider. So your medical provider would like to know if the claim that you put in there is backed up, right? So you don't want to say that you've had an aneurysm when you actually had a headache, right? So the best way
Yeah.
to support this claim that you've had an aneurysm is to have a supporting document from your doctor that said,
Mhm,
yeah,
mhm,
this person has experienced aneurysm before.
mhm.
So at the end of the day, that is what your medical records is, right?
Can you describe the process for someone to get into the system and until the doctor is being able to retrieve the information from the website?
So we created something called a web app. So basically, if you visit our website, it is its own app, basically, right? You can save it on your phone.
Yeah.
And the process is quite simple. You have to have an activation code to come on board, right? So once you have the activation code, you can sign up. And from then on, you can already start actually building your own medical profile in there. It doesn't get any easier than that, you know? So we don't
Yeah.
have any like know your customer verification. I mean, we don't have anything like this yet, right? So what we really need you to do is honestly, is in your best interest, in fact, to have your medical records right, because otherwise
Yeah.
it will not solve the problem of you getting the treatment that you need.
And what can we sort of benefit from this technology, especially in terms of the security issues? How can you affirm users to ensure that their, information is safe?
Yeah, right. I love this question just because, technically speaking, this question has posed, I mean, in recent years, a lot of challenges, right? With the, when we talk about data security or privacy, we talk a lot about, in the past, we have, Meta or Facebook, right, breaching this trust, selling our data. So how we differ, or what we do different, is that we have designed a system for privacy from the get-go.
Yes.
So your information, actually, when you upload to us, is encrypted to you, to your credentials, and us as a people who build it, we can actually only manage your information, but we don't actually get to read it.
That's good.
Yeah, yeah, and
So
it,
at
yeah,
least
and
I
it's and
know.
it, right. So yeah,
At least someone who
and
had STD, you wouldn't know.
yeah, no, we can't, we don't know, unless, I mean, we don't even have to go into like actual medical conditions, you just
Yes.
ask people about their height and their weight, they're already touchy about these things, right? So
Yes.
yeah,
Yes. Yeah.
we
Yeah.
can't see any of them. All we can see is basically the, let's say, the key to the data. So meaning name, right? Rafi. Even we only knows the name, the weight, but the actual value to that is what is encrypted. So we have no way of actually decrypting this. In fact, one of the challenges that we see from our users is that when they forget their password,
Yes.
right?
Yes. Yeah.
Yeah. Then the problem is because, well, your data is encrypted to you, to your password. So unfortunately, if you lose it and you don't have what we call a backup key, which is a spare key to unlock your medical data, well, technically speaking, that data is lost forever.
So can someone lose a password and then change the password by email or something?
If you lose a password and you have the spare key, then it's not a problem. The problem is
So
when you lose a password and you don't even have a spare password, let's say. That is when the
right.
problem happens. And we've had users who reach out to us and told us like, hey, I kind of forgot my password and I misplaced my backup key. And we're like, oh God, because technically speaking,
Oh,
we can't decrypt this information for you, right? Because by
right.
design, we call this process or this architecture as zero trust design. And the idea of zero trust design is to design a system in such a way where you trust nobody in the system, basically, right?
Okay, so
Right.
basically, the backup key,
Hmm.
it's with me, and then someone else has that access to that backup key. Can they get access to my?
Yeah, yeah. If they have the backup key, then they will have access to your medical data. Yeah, but
Mm,
what they have to do is basically they have to, of course, we have necessary steps before that, right? So they can request that they've forgotten their password, but well, they still need your email, right? So you know
okay, okay.
how nowadays
Yeah.
if you suddenly get the email like, hey, somebody tried to change your password, you get a notification for that, right?
Okay.
So if it's not you,
Okay.
please ignore it. Yeah, we do have that process in.
Yeah. I think that's
And
safe enough.
yeah, I would
Yeah.
hope so
Yeah.
too. I think right
Yeah.
nowadays, everything becoming in the, all information are basically stored in the cloud. I think this is a fair question and a very important question, regarding medical
It
data,
is.
right? Just
Yeah, it
because
is very.
medical data, if you go to the black market, you can find people can buy your financial data for like maybe $3, $4, right? Your
Hmm.
whole
Hmm.
financial record, let's say, they can get it for $3, $4. But your medical records, it will cost them up to like $300, $400, actually,
What would
right?
he do with my medical record if someone were to buy it?
Well, there are multiple ways. So, for example, if it's in the wrong hands, then what it can do is Um, yeah, it can be life threatening, right? So if let's say you have a peanut allergy and that managed to get out there, right? So people can just I mean, this is of course it's like a James Bond kind of scenario, right? Trying to take you out, but at the same time, what most likely will happen is that your medical data is leaked to the pharmaceutical companies, right? So now they can
Mm.
tailor or pricing, yeah, or do a pricing because you need this medication, and then they can price it however they want because you need it, right? And apart from
Mm.
that, if your medical data is leaked to employers, well, this can also jeopardize how long you're at the company or if you even get, let's say the job that you've been applying to. Because a lot of job
Yeah.
nowadays, if you're traveling a lot or you're working in a high risk environment, medical examination is mandatory, right?
Hmm. Yeah, it's true. Yeah.
So this is how it can leak out if you don't want it to leak. And
Yes.
at the same time, you're identifying yourself, right? So not
Hmm.
only that you're identifiable by your, social media handles and all of this, now they have
Hmm.
another marker to identify you based on your medical records. To answer your other question, like the benefit that you can get from this is honestly, I think we are only scrapping the surface, right? Because right now it's not common for you to store your medical data with yourself,
Hmm.
right? But the idea is, hey, let's see what happens. Because right now, if you take control of your own medical data, you
Hmm.
can decide if you want analysis on your medical records, right? So now you can have
Mm.
predictive analysis of what you might have,
Right. So the
right?
system would actually predict what the diagnoses are.
Yes, yes, we
Yeah.
can do that, yeah. But at the end of the
Okay.
day, going down the route where we actually diagnose you is at the moment out of the scope, just because, to actually diagnose somebody, you need to go to medical school,
Hmm.
right? So
Okay.
what we can give you is just predictions of it. So you have your medical records there, you can get
Hmm.
predictive analysis,
Hmm.
and the more you record and the more your family members record about this, then it can
Hmm.
actually paint your medical profile as a family, right? So now not only your kids, but your grandchildren will have the ability to preemptively mitigate any medical condition that runs in the family, right?
Mm.
So, famous news recently, like Chris Hemsworth, the famous Thor, is taking a
Hmm.
break from acting because he realized that both side of his uh, family, right, his parents and his mom and his father's side, the grandparents have Alzheimer's,
Mm.
right? So,
Yeah, I heard. Yeah.
yeah, and Alzheimer's is one of those medical conditions where you don't get to mitigate it when you get the diagnosis. It's like 30, 40 years in the making. This is what Alzheimer's is. So you
Yeah.
have to stop it at the spot. And another example we can look into is a famous Angelina Jolie, right? So this is quite well known that she removed her breast, and if I'm not wrong, also her ovaries, in fact, or her uterus. And it's because in her family, her mother and her grandmother and her siblings have experienced like breast cancer or uterus cancer, right? So she removed so that she doesn't have to experience those, just because she's predisposed to have it, right?
Ooh.
So what we trying to say is that, well, we not necessarily give you like the analysis that is meant to be true, and then therefore you have to act, but rather like this is the facts that you didn't know about that runs in your family. Now you get to decide what you want to do with it.
Right. And the reason I'm very excited about this conversation because I have used something similar in the past, and
Mm-hmm.
then for me, I think at the time it was so easy to actually see everything there
Right.
because, like you said, most of your health data is not with you. it's at the facility where you did your test and where you see your doctor or your primary care,
Right.
and having them all in in the palm of my hand, and then especially when I get to see what the results are, I can um, monitor my weight, the
Right.
fluctuations of my weight, if I'm having any issues with mental health or eating disorders or anything like that. It's actually easy for me to talk to my doctor and say, hey, I noticed there is this weight change rapidly,
Right.
so that I can see it from my phone and tell him or tell her, tell the doctor that there's something wrong with me. And also at the same time, if I see my lab work is showing signs of um, high cholesterol or high sugar or something,
Yeah.
you can act you can actually plan.
Right.
Plan
Right.
either if it's medical or your health whatsoever. So how is this working for people like me, who is it just for people who travels a lot, um or if I just stay at one place now, would it work for
Right.
me because I have everything there at one place? Why would I need this?
Basically, it revolves around who will need their medical data with them the most, right?
Yes, what
So
type of
at the
people that
what
would
type of people
actually fit?
exactly,
What type of people? Yeah, like
exactly.
because you mentioned
So
about people who travels a lot, and of course you want to target as much as user that would really optimize this and utilize this to its fullest potential. That's the aim.
yeah, that's
So,
the
but
aim. You know,
how? Yes, that's the aim. But what's your role to actually not just to promote this, but to be at the convenient of any users, not just in Malaysia, but for anywhere in the world that can really rely on this? Because the app that I was using is from a hospital. That
right.
was the hospital that I go to, and that's it. And then I can take it with me anywhere. And then every time I get my results and everything, it will just prompt a notification that it's done. And I have the next appointment. I can cancel. I can talk to my doctor. I can email. I can talk to the nurse. I can retrieve all my vaccination records. My son's is in there and everything. So, but that's just one, hospital. But this is sort of
Right.
like it's for everywhere. Like literally anywhere you go, anywhere you see, you can retrieve all your data by obtaining those information from your doctors and anywhere you go. But what if this person is just staying at one place? Would it be, reasonable for them to use it?
I think we'll come back to the problem that we're trying to solve right now, right? So,
Mhm.
for example, the problem is people go see the doctor and they don't get what they need. Why is this?
Yeah.
And who actually experiences the most?
Mhm.
So when we look at health people who travel to get healthcare, right? So
Mhm.
they kind of are the ultimate people who would use this, right? Because they leave their country to a
Mhm.
place where they do not speak the language. Let's say, most scenarios are like this,
Right.
and they go get their medical treatment, they get their diagnosis right, the treatment, and then they have to come back to their home, and then there's a follow-up treatment with their own medical practitioners where they live in. Right. So
Right.
the movement of their medical data is from their home to the country
Mhm.
that they're going, and then from the country that they've been back to home. Right. So these are the group of people who want to use it most of the time because the data's moving anyway. Might as well make it easier.
Mm.
And now we're looking at the second scenario about people who stay in one place. And I have to tell you, mate, like the dream is to go like, hey, Nexuses is for everyone, right? Anybody
Mhm.
can use Nexuses, and everybody
Mhm.
will use Nexuses, right? But unfortunately, if you stay in one place and okay, if you stay in one place, the benefit that you will get coming on and having your medical records here is that in the events of you getting some serious medical concern, then
Mhm.
you are easy to get second or third or fourth opinion than you are if you just leave your medical data with the medical providers.
Yeah, you're absolutely right. Yeah.
Right? Because now, okay, your medical data is with you. Well, you can basically go anywhere in the world. You're no longer restricted to doctors here for a second opinion. Right?
Hmm.
You can get your test done, your MRI, your X-rays, record some physical tests that the doctor does, is doing to you. If you have some mobility issue with your shoulder, you can just record all of this, and then you can just share
Yeah.
it with any doctor in the world and go like, hey, what you think about this, man?
Yeah.
What's your
Yeah.
opinion on it, right? Yeah.
Yeah.
So
Yeah.
I think that is the benefit if you don't travel, right?
Hmm.
Because again, coming back to its foundation is that you just need to get what you need. You just need to get back to your livelihood, and this is the aim for it.
Right. Right. Wow. Wow. I think what you're doing, what you're starting is really amazing. And I see and understand that you have support from Microsoft and Magic, the Malaysian Global Innovation and Creativity Center, and then some other support as well. How do you feel about that?
It feels good, to get the support, definitely, right? Because
Hmm.
I mean, where when they're underdogs, or just a small kid, or like just kids, right, trying to start this one out, and
Yeah.
you need to have companies like Microsoft or Magic, which is again, I want to give a shout out to them. They made what Nexuses is officially, right? They helped us actually incorporate last year.
Yeah.
So
Yes.
people might know them under a different name nowadays. They're called Meranti. So
Hmm.
it's good to see, for example, a Malaysian, the government agency, trying to support the local startups here, right? And
Yeah. Yeah.
and Microsoft, giving us their expertise on how to best help, patients store their medical data. And not to mention, we have also MongoDB. It's not that common unless you're, a techie yourself, like a tech
Hmm.
developer. But
Hmm.
they are actually who we store our data mainly with.
Yeah.
And yeah, and they're just a superb company, really. They're quite new themselves. I mean, must be less than 10 years that they've been
Hmm.
here. So yeah.
Mm.
So nah, I love it. I love to get the support, and anytime somebody asks if we're connected, or supported by anyone, those three names are definitely up there, right? So we're also supported by entrepreneurship program of Technical University of Munich.
Hmm.
So having their support,
Wow.
yeah.
Wow. Wow. Well
So
done. Well done.
yeah, it's been good. It's been good. It's been fun as well.
Yeah.
So to
Yeah.
get to know these
Yeah.
people, yeah.
Any chance of going to, you know, the Silicon Valley?
Silicon Valley. Ooh.
Uh-huh.
Every time I get this question, definitely, the dream. I
Yeah.
think Silicon Valley is also it's a must. It's
Yeah.
just a
Yeah.
milestone, I suppose, for a starter to eventually
Mm.
end up there. I think um, I think ending up in the US, for example, in the Silicon Valley, will be very, very good for us, for example, just because uh, US actually has more records of misdiagnosis cases there than anywhere else in the world, right?
Yeah. Yeah.
And 5% of people in the US who travel, with flights, they actually travel to seek medical care.
Yeah.
So
Yeah.
yeah, it's pretty big there, and
Mhm.
who
No,
doesn't want to bump
it's funny.
shoulders? But who doesn't want to bump
It
shoulders with Elon Musk, or
but
who,
it's funny.
or
It's funny
Graham?
that they have what do you call that? They have one of the highest numbers of misdiagnoses, and yet people, including myself, seek treatment in the U.S.
Yeah, yeah. I mean, I suppose it's a double-edged sword, right? So, okay, US
Yeah.
really high tech, but at the same time, maybe there's only a concentrated amount of hospitals who are not prone for
Yeah.
misdiagnosis, right?
And speaking
Uh,
of which, they probably have sold my medical data too.
yeah, yeah. Our boy Mark Zuckerberg probably has more data on you. Facebook's not doing too well right now. teaching them. Anyway.
All right. I think it's wonderful how you share about Nexuses, how it started. But let's get a little bit personal in this journey. And what are the barriers you face in this journey? What is your advice to those who are struggling to find something in their life, to do something they love and actually, enjoy doing it, but also to stay consistent?
Touching on consistency, that is a great point. But I think, I get to consistency, but I think one of the biggest barriers that I face, as personally so far, is definitely, I have the need for, who doesn't want to build the perfect solution, right?
Yeah, yeah,
So, but chasing perfection left unchecked is actually quite harmful in a way where you're just living in your mind now.
yeah,
Nothing is
yeah.
actually happening. You're more thinking than you are doing,
Hmm.
right? So yeah, people who are thinkers, people who are doers, but what you really want to be, I think, is that you want to be in the middle, right? You don't want to just do, right? But you also don't want to just think.
Hmm.
So I think the problems that I'm facing is that, I've been trying to develop this Nexuses Chronicle, the app, for
Hmm.
about close to, let's say 2.5 years.
Hmm.
And out of 2.5 years, I just released it this year, right?
Right.
So which is basically after 2.5 years. And if you ask any tech developers out there, most of them will say like, oh, we launched within 6 months. We launched within a year, something of this nature, right?
Hmm.
So and it's just the fear that, I suppose, not being able to have perfection, comes from the idea of maybe imposter syndrome, right? Like you're never good enough, you're not good enough until you
Yeah.
get the
Mm.
perfect thing. So
Mhm.
I used to spend hours just designing this thing and thinking of all the possible scenarios of what can go wrong, as much as what can go right, and just spending time doing that is actually, you're wasting time, right?
Yeah.
So
Yeah.
you might,
And
and never try, never know, right? So you got to try, and you got to build
yeah.
something if you're really in for it. And I feel that personally, I'm a very disorganized person,
Mhm.
very disorganized. So,
Yeah.
um, becoming a founder, becoming an entrepreneur, you're basically your own boss. Not really going to slap yourself on the wrist if you spend a bit too much time on YouTube, right? Or on 9gag, I still go on 9gag nowadays, so, or on
Hmm.
your social media. So a big part of my journey as an entrepreneur is actually to learn to have self-discipline, right? To
Hmm.
understand that, focus on what is meaningful instead of what is impulsive, I suppose, right?
Hmm.
So
Yeah. Yeah.
and to always have that long vision, because I think consistency comes from the long vision. Because if you don't know what you're working towards, I think you're just going to wander around aimlessly, right?
Yeah. Yeah. Mm.
So
I totally
yeah, I
get it.
think,
I totally get
yeah.
it. Yeah. Nothing is easy in life, and then of course, having the courage to try something that you're probably not, used to, or something that might ended up well or not, is brave enough. But of course, being able to actually overcome that challenges and cope with it, I think that's the strength that I think you have to actually sustain this for this long, and also continue this journey and for the future to come as well.
I think find something that you really want to do, and it must have it must have a little bit of use. It can't just be for fun, right?
Yeah,
So,
yeah.
and if your dream, if the vision that you have is important enough, that is the ultimate question, I think, as an entrepreneur. Is it important enough for you set aside certain things, right? Is it important enough for you to still connect with the people and see what they think, right? So
Yeah.
if you can ask yourself this question, you might see it as an abyss, right? Scared of the right answer, but
Hmm.
I think the way to be a good entrepreneur is always to see, okay, there's a problem, but I'm sure there's a solution, right?
Yeah. Yeah.
And because the vision is meaningful to me, I'm going to stick it out and see if I can work it out. Coming
Hmm.
back to consistency, is just, yeah, you might not see it in a day, right? You might not see it in a week, but if you keep on trying and it builds up, you build the momentum slowly, of course,
Hmm.
at its bare minimum, you're bound to see something actually.
Yes. Yeah.
Yeah, uh, and sometimes you don't even notice it until you look back.
Yeah.
So yeah, I mean, I've had that experience already, right? So I didn't think it was much, getting to, like, say, network with certain people or test the app with certain people, right? And when you look back,
Hmm.
actually, no, if I were to ask myself from day one, would I have done this? No, never. I don't
Mm.
really want to
Mm.
speak to people, or I'm shy, whatsoever, right? It can be, but
Hmm.
yeah, if you stick it out, then the self-discipline will reward you in itself. Right?
Yeah. Have you ever felt like giving up? Like, you know what, this is not something that I want to do at all. Like, I know it was a dream 2 years ago, but I don't know. Now it's like, have you ever experienced this sort of thing?
uh,
If
uh, have I ever felt like
Have you
giving
ever felt
up?
like that? Because I do at every stage of my
Right,
life, be it in a relationship, at work, with the things I love, and whatever it is. It is always something like, oh, this feels crap. I want to do something
right,
else. Or is this really my dream? Or is this really something I want? Is this something that I hope for? And then I do carry on for certain reasons, but in my journey, I'm in my 30s now. In my
right.
entire journey, going to school and getting an education, for example, because I did computer science and I did not like it. And then I work for
Right,
something that I never imagined that I'd do, but something that I'm really good at. But in between, and of course, if I know that I'm, no longer interested in something, I will like, you know what? I'm going to try something else. And I move on with it and
right,
start something new. To start something as critical as this, something as I can say quite larger than life, as at your age, to be calling yourself entrepreneur, how do you see yourself, in 5 years from now? And now that you have started something, do you ever feel like, not just about giving up, but do you ever feel like this is not something that I actually like to do and I stick to it just because? What's your next move if this
right.
ever happens to you?
I think it's healthy to ask oneself, it's like, is it enough, or when is enough, right? Should I give up now? You know,
Mm.
um, I think it's very healthy to ask oneself this, and I don't think I've definitely asked, but I know the answer, actually,
Mm-hmm.
and I don't think about giving
Yeah,
up.
yeah. I
Definitely,
don't.
yeah.
I
I
don't think
and
you.
I've
I
and
don't
I've
think
had
you do.
some.
I don't think you do because
Yeah,
you don't trigger
no,
easily.
yeah, like, oh, trigger, like, no, no, definitely don't trigger, mate. But
You don't
in fact,
trigger.
most often than not, I can talk to my mates. I'm the one triggering people, so.
Yeah, exactly.
Uh,
You just triggered me. You just triggered. I'm an emotional being, and you're not, and we're having this
yeah, like,
conversation in
what?
the moments.
Exactly. I'm like, why, why trigger? Why get triggered? So, no. Uh, I
Okay.
think No, I think yeah, asking oneself is important, but no, I don't think it's something I would give up. And I've had rough days with the startup, right? Because
Mhm.
in its infancy as well, I started it all by myself, right? So I started it. A lot of it is also self-learn, speaking to some people who are more knowledgeable than you, right?
Mhm.
And and to get also to get some negative feedback, it builds you up, it makes you a bit thick skinned, I suppose,
Yeah.
and to
Yeah.
understand that what lies underneath it. And
Yes.
although I've had rough days, no, I've never thought about like throwing in the towel, because I think it's important that we get the right medical treatment. I think it's such a stupid thing to happen if the medical treatment is there, but you just happen to get it the wrong one for whatever reason, right? I think it's just so unfortunate, and this happens to everybody. Um, and no, I don't f- think I'll sell it. I want to make this into a full-fledged thing, so how
Mhm.
hopefully you'll see Nexuses up there with Google and Amazon and all of this.
Yeah.
But yeah, but no, I if it's important enough, you'll stick through it, right?
Mhm.
And it's a marathon. It's not a sprint. So nobody's gonna in my case, nobody's gonna give me a trophy that I managed to, create this into a successful startup in a year from now, or in 10 years from now, or
Mhm.
15 years, right? What's important is that you have a vision, or I have a vision of my own world, and I just want to make it come alive in my own world.
Yeah.
So,
Wonderful.
yeah.
Wonderful. Um, what is your defining moment?
I think doing the hard things and boring things that is not as flashy will always be a defining moment for me, right? Because I think when at least when I think about founders, it's always like, big name founders, right? Or CEOs, like again, like Elon Musk or Steve Jobs and Graham, and I mean, all these famous entrepreneurs and innovators.
Mhm.
Um, and I think I mean, even at this fundamental, it's just that okay, those people or every founder will just have to do things that they don't want to do,
Yeah.
and you persist and you stay consistent because you have a goal and you have your vision basically. And whenever I am stuck at solving a problem, within the startup on my journey as an entrepreneur, I always look back to this. It's like I think you just have to power through. Have faith. It will work out. And
Yes.
my contribution to the world, what I want to do with this is again, I'm not trying to change the world, the
Mm-hmm.
objective world. I'm trying to change my world,
Yeah.
and the people who are in my world. And I think um, to leave this world one day knowing that I have helped the people around me, or people, after people around me, I should say, is that I leave them with a better medical, let's say, journey than what they had to go before, right?
Mm-hmm.
Where they go see a doctor, they go to the hospital, and they get exactly what they need from the get-go, right? From the first one, right?
Yeah.
There's
Yeah.
no need to go for the second or third or fourth, right? Just from the very first one, you get what you need the first time. And that is the world that's how I want to contribute back to my world, I suppose.
What is your most valuable lesson in life? What are the words of wisdom you hold to?
Okay, I can. So definitely number one or somewhere up there, the top three, let's say, is never try, never know.
Mm-hmm.
Right. So I think this balances the idea of always overthinking about things. So
Yeah. Yeah.
and I think that is the antidote of overthinking. Just try, see what happens, and then adapt to it.
Yeah.
Second is, you know, he who asks is a fool for 5 minutes, but he who never asks is a fool forever.
Wow.
So yeah, so I think have the humility to not know, and then you're always curious, right? You're always like, hey, what's this? It's always fun to find out new things, right?
Yeah.
Trying new things, right? So and no, it I think right now it's more important that you learn to find out rather than finding out from the right one from the first time, basically, right?
Yes.
So
Yeah.
I think in our culture as well, or I mean, a lot of places I've been, people are still afraid to ask because they might seem dumb or they're afraid that they don't know anything. But no, it's actually an opportunity to better yourself, right? So
Mm,
ask away. In fact,
yeah,
you know this more than anybody, I suppose, right? You talk to people.
yeah,
Asking the
yeah,
questions is actually fun for you to answer, right? Like to
yeah,
tell
yeah,
what your thoughts are. And
yeah.
I mean that's definitely up there. And I think the last but not least is actually to leave the place you come from better than you got there.
What are your hopes and dreams?
My hopes and dreams. I going being on this journey right now has been hard and has been taxing, of course, right? And I'm getting support from a lot of people, and one of my hope is that I get to share the fruit of my labor, before it's too late, let's say. So that's definitely what I hope, and what I dream is, we have a lot of local boys here who are doing crazy stuff, as a startup, where they're innovating here in Malaysia here. And I think my dream is definitely to see Malaysia as a tech hub, right? Maybe we can be just as good or even better than Singapore, right? We have infrastructures that other Southeast Asia countries are dreaming about, right? Apart from Singapore, because they definitely have everything there.
Yeah,
But unfortunately, it's unfortunate that a lot of our boys here, a lot of entrepreneurs here, kind of think that they have to leave Malaysia to be big. So I love to one day see, that Malaysian startups are actually being supported and being proud by other Malaysians, right? Because right now, it's actually common that some Malaysian startup make it out there, and only then we're kind of proud of it, right? Rather than
yeah,
building it up here, molding those, the entrepreneurs here, and then let them fly out into the world. We have an access code for Rafi and his listeners. Okay, so it's Rafi 2022. Okay, so this will allow your listeners to come on board and create a profile and store their medical data securely, right? And they can access it wherever they want. And it's free, actually. We believe that this is a way forward, and your data is yours. Take control of it. We will never charge for this. And when we do roll out new features, especially in the premium plan that we might roll out in the next year or so, well, your listeners get to enjoy the benefits of premium for a year.
wonderful.
So, yeah. And again, just to stress, we're here for feedback, right? So try the app, store, tell us if it's wrong, tell us if it's rubbish, one way or the other. We love to hear back from you. And yeah, so hit me up on my Instagram or on the email, or sorry, on the website, on our website, nexuses.io, and I'll get back to you shortly.
Thank you, Tash, for joining me today. I think you're an inspiration to me. All the best in all that you do. I hope you will, go far and achieve all your dreams. And I really, vision you to be very successful. Thank you for joining me today.
Hey, thanks, mate. Thanks for this platform. I'm excited to be here.
Thank you. Thank you for listening to He. A new episode is available every Thursday, and don't forget to subscribe, rate, and review. We'd love to hear from you. Follow me on social media at Rafi Rizwan and at He Podcast for all the updates and behind the scenes. Once again, thank you for listening to He with Rafi Rizwan.